located pericardium 8 point. Now one location, easy location, I'll tell you. You just do it like this. You just do it like this. You just do it like this. The middle finger where it touches, that is the pericardium 9. So you touch, yeah, pericardium 8. When you touches this, that to be known as a pericardium 8, one theory. When you touches like this, there are the third and then fourth finger where it touches, midway between, that is the pericardium 8 point. But however, we can recognize this is the pericardium 8 point. But you can see this entire region, yes, hold it, yes, this to be known as a pericardium 8. So now pericardium 8, you can just do it once again, yes, leave it again, yes, pericardium 8. I just connect from here to here. You just take deep breath, you just take deep breath, yes, good. Right. So I just applied towards the, some of the authors they write the point is located on this region. The point is located on the first palmar crease and then second palmar crease. So on the second palmar crease the point is located, authors has written. But by the way, I can tell you the point is I just applied just superior to that region and then that connecting to this region as well. But however, some authors believes that the base of the third and then fourth, the base of the third and then fourth metacarpal bone on the palmar side is the right location. But you remember this point is good point to treat for the pericardium 8 is good point to treat for the pituitary gland as well. When the pituitary gland is good, then the entire endocrine system also good. So hopefully we can recognize this point is good for the hypothyroidism, where the TSH level, thyroid stimulating hormone, get excessiveness, that is greater than 7, 8, 9, 10, 12, 15, 20, 30, 40, 50, 100. So that time also you can use the pericardium 8 point is good. There is another location for the pericardium 8. This point also to be known as the pericardium 8. So these are the 2 points also. Pericardium 8 is good point both the way, or you wanted to apply. Maybe I am not making you all confusion, but the entire region, but this to be known as a pericardium 8. There are the 3 locations also to be considered as a pericardium 8. Sir, which is the correct point? But all the 3 points also correct point. But when you apply the center point, that also correct. But make sure on which place you want it to apply. The meridian is the pericardium 7 is here, then the pericardium 8 is here, then the pericardium 9 is in this region. So the pathway you can see how to recognize that. So whether I wanted to apply in the central midline, show exactly on the central midline I wanted to show you. This is the central midline I wanted to show you. This side or this side. This is very important, right? I just wanted to apply on this side. Now the pericardium 9 point. This is what are the indications. Normally there is a perspiration, a sweating of the hands, and by the way this also to treat for the cardiac related disorders and also brain related condition. So hopefully we try to find out once again. Draw the location. You just give the pressure from here. You just come down. You just come down like this. How to locate the point? You just come down, and then where the finger get stopped, right? From here you just come down. This is the pericardium 9. From here you just come down, come upward direction. Smoothly the fingers is going. Then it stops. That to be known as a fourth and then fifth metacarpal bone, right? At the base here that is. But however the point is we are locating from here, right? The metacarpal bones. This is the third and then fourth metacarpal bone. The base is here, but from here I am just finding from here. So this and this, both the locations are more or less the same. So from here, this point to be known as a pericardium 8, and at this point also pericardium 8, and then you come down from here where it gets stops, that to be known as a pericardium 8. So this is the head. This is the head of the metacarpal, and this is the base of the metacarpal. So remember, this is the base where the metacarpal bones starts from here, and then head. These are the knuckles, head of the metacarpals, where the head of the metacarpals ends. That to be known as a anterior to the head region of the metacarpal bone in the depression. This to be known as the pericardium 8, as per the different authors, right? So now the electricity can be taken place from here. Now the last point is not least, but now you can recognize is the 2 points. I can apply the needle over this region. Take the deep breath. Just take the deep breath. Yeah, you just take the deep breath. Yes, now this point to be known as a pericardium 9. The direction, you just see how I just applied. The direction, you can see how I applied the 2 points. Both the points, because this point to be known as a chung chung, that indicating is the mother point of the pericardium. Mother point. There are the points called as a mother point, sun point. But this belongs to the pericardium 7 is the sun point. Pericardium 9 to be known as the mother point. That indicating, mother का मतलब क्या है? It provides the maximum energy to that particular orb. So that means the brain and then is the heart need to be activated. Then you can use these 2 points together. Maybe use single point. Some authors says that this is the pericardium 9. Some authors as per the traditional Chinese medicine, but this point to be known as the pericardium 9 at the middle tip of the middle finger. As per the Korean philosophy, it says point 1 shown proximal to the radial corner of the nail base of the middle finger to be known as the pericardium 9. So therefore, but both the points are okay, but both the points are good. As per my recognition, both are qualified points. But now you can recognize one is tonified. Pericardium 9, I just applied tonification towards the energy flow. Then the pericardium 9 also applied here, but I didn't apply the needle. But when I wanted to sedate the same point, I just applied the needle in this direction. So I just applied this direction, that is a sedation, but this to be known as a tonification. Hopefully you can recognize, but this point also to be known as a, shall I tell you the secret?
Yes, sir.
Really you require? The pericardium 9 point also to be known as a ली दोई का मतलब क्या है? No, pericardium, yes, 9 point also to be known as a ली दोई का मतलब stomach 45. How amazing is it? You can see as per the micro meridian, as per the Sujok meridian, then you can recognize this point to be known as a ली दोई point, stomach 45. Stomach 45 gut को भी ट्रीटमेंट करता है और साथ में पेट को भी ट्रीटमेंट करता है, और पेट और इंटेस्टाइन दोनों ठीक है तो फिर आपका ब्रेन भी ठीक रहता है. थोड़ा बाजू करो प्लीज.
Sedative needle is passing.
Yes, in this direction, yes. So hopefully you can recognize, but whenever there is emergency energy is required. Emergency?
Energy is required.
Yes, the pericardium energy, the fire energy is required. कोई आदमी सो रहा है क्लासरूम में तो फिर उसको थोड़ा प्रेशर दे दो. ये पॉइंट एक साइनस पॉइंट भी होता है. दिस पॉइंट और द वेयर द नर्व एंडिंग्स गेट टर्मिनेटेड इन दिस रीजन. ब्लड सप्लाई होता है, ब्लड सप्लाई होने के बाद फिर वापस जाता है. इट्स कनेक्टिंग टू द एक्सचेंज ऑफ द गैसेस, एक्सचेंज ऑफ द ऑक्सीजन एंड कार्बन डाइऑक्साइड टू बी टेकन प्लेस. यहाँ पे जो वेन्स होते हैं, डिजिटल वेन्स होते हैं, डिजिटल आर्टरी होती हैं, पाल्मर आर्टरी होता है, और यहाँ पे lumbrical artery भी मौजूद रहता है. When you are activating to these points, hopefully you understand the pericardium 9 point we completed. Do you have any questions? And then we'll move on to the next meridian.